Good afternoon. Welcome to the Thurston County Board of Health meeting for Tuesday, April 13th, 2021, 4:16 p.m. Apologize, we're getting a late start following 2 public hearings and a regular board meeting. But here we are ready to go. My name is Ty Menser, Chair of the Board. We have Vice Chair Commissioner Carolina Mejia and Commissioner Gary Edwards. Director of Public Health and Social Services, Shelley Slaughter, and our County Health Officer, Dr. Dimiana Abdulmalik, as well as some public health employees and a guest, Ms. Shelley Willis. So we're going to start by calling the meeting to order. Again, 4:17. I will ask for a motion regarding approval of today's agenda.
Motion to approve the agenda for April 13th.
Second.
Been moved and seconded. All in favor, say aye.
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 Motion carries. And board meeting minutes from March 9th, 2021. Is there a motion?
Motion to approve the meeting minutes from March 9th, 2021.
Second.
Been moved and seconded. All in favor, say aye.
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 That motion carries. Those minutes are approved. At this point, we have a proclamation, and it relates to Child Abuse Prevention Month. And I'm going to turn this to Shelley Slaughter to introduce this proclamation.
Thank you so much, Mr. Chair. I'm Shelley Slaughter, Director of Thurston County Public Health and Social Services and Administrator of the Board of Health. And it is my pleasure to be here today to ask the board to proclaim April as Child Abuse and Neglect Awareness Month. Today we have Gretchen Toller, who is the manager of our maternal child health program, as well as our guest, Shelley Willis, who is executive director of a local nonprofit, Family Education and Support Services. And I will ask Gretchen to further introduce this item today. Gretchen?
Thank you, Shelley. Hi, I'm Gretchen Toller, and I am with Thurston County Public Health Maternal Child Health Manager. And thank you, commissioners, for recognizing child abuse and neglect prevention and the importance it plays in our community's health and future. Community members may have seen the pinwheels at the Capitol and around town and other places, recognizing the national child abuse prevention efforts. Child abuse is a public health concern that impacts the health and well-being of our children, families, and community. We know that too many children in our county either have or are at risk of experiencing abuse. And while we know that there are ways that we can build resilience in children, research shows us that experienced abuse changes the developing brain. This change can impact the way they respond to stress and other experiences throughout their life. So what is happening in our local communities? Between 2015 and 2019, the number of children that were reported to have experienced abuse in Thurston County increased by 42%. Unfortunately, in 2019, the rate of child abuse in Thurston County was higher than the state average. We know that last year of the pandemic has been very stressful. And while we do not have data yet for 2020, we suspect that the rate may have increased and that this rate may be underreported. We know that not all child abuse is reported to government authorities. Surveys of local youth demonstrates this and shows how common child abuse is in the community. For example, in 2018, 19% of Thurston County 8th graders have reported that they had experienced physical abuse at some point in their lifetime. In addition, 35% of Thurston County 8th graders reported that they had experienced psychological or emotional abuse at some point in their lifetime. To be successful in preventing child abuse, we must look at factors beyond just those at the family level, but include also those at the policy level, community organizations, and social norms. This takes all of us working together as a community, as not one organization, policy, or program can do this alone. Fortunately, we have many community partners that continue to be dedicated to working towards building supports for families. With that, I will hand it over to Shelley Willis from the Family Education and Support Services, and I thank Shelley for her ongoing partnership.
Thank you. Thank you, Gretchen, County Commissioners, Shelley Slaughter, and other leaders joining us here today. Spring started, it's announcing its presence, and for much of the country, that means milder temperatures, longer days, and the promise of a garden full of flowers and nourishing food. Spring is the embodiment of hope and also brings an opportunity to cultivate a different kind of garden, a pinwheel garden, for example. April is Child Abuse Prevention Month, and pinwheels are a national symbol of recognition for children impacted by child abuse and neglect. You can see a beautiful display of a pinwheel garden in front of our Thurston County Health Department. Pinwheels shining in the sun are reflective of the bright future all children deserve, and our belief that getting it right early is less costly than trying to fix it later. Pinwheels represent our hope for every child to be raised in a healthy, safe, and nurturing environment, and they serve as a reminder that we all play a role in children's lives, that the choices we make and the actions we take today will inform how we nourish and flourish for years to come. Whether you're an individual, a business, or represent a corporation, you can make a difference in the life of a child. You can ensure your employees are striving for work-life balance. You can offer a neighbor respite from the demands of parenting, and you can smile brightly and compassionately at a parent struggling to navigate the grocery store. We all have an effect on the lives of children. We invite you to join with us in showing your support for the great childhoods all children deserve by planting a pinwheel garden in your house, in your yard, in front of your business, and we'd be happy to help provide pinwheels to folks who are interested. You can visit our website at familyess.org or give us a call. We'd love to see pinwheels across our county through the month of April, the remaining month of April, and forever after. Thank you for joining us here today, and we look forward to partnering with you to prevent child abuse and neglect.
Thank you, Shelley. Any questions or comments from the board? I'll start with Commissioner Mejia.
No, I'm just very happy that we're passing this proclamation, and very happy to support Shelley with this. Thank you, Shelley.
Commissioner Edwards?
I guess this is where I get to bore Gretchen because she's heard this many times. I mean, these kids are, 30% of our population, but they're 100% of our future. And it really behooves us to do whatever we can do to get it right if we want a bright future down the road. Maybe it'll match this beautiful day. Thank you.
Thank you, Commissioner Edwards. And it never gets boring to hear that. Never, ever.
The Board of County Commissioners and the Board of Health we haven't done a lot of the proclamations in this last year that we would normally do just because of the environment of having everything be online. Took us a while to get used to that. This though was an important one, and because the dynamic of the pandemic it's always an important issue, but it seemed like it had a different dimension this year with family dynamics changing. And probably kids at greater risk in different ways. So we thought this was an important one to include. And I'd like to thank Shelley for being here because it means a lot to have someone from the community to come and share this with us and spread this message. And the work that you do is very well appreciated by the board. So with that, we have our pinwheels, and I'll find a good place for mine. And I know that we thank you for that. Okay, let's go to item 3, opportunity for the public to address the Board of Health.
Commissioner,
Yes.
you may want to read their proclamation, perhaps?
Yeah, that would be good. I skipped right by the proclamation. Sorry about that.
Okay.
Commissioner Mejia, I believe, has the proclamation.
Yes. So Thurston County Board of Health proclamation, Child Abuse Prevention Month. Whereas children are the foundation for a prosperous and innovative society, and the foundation for a child's growth and development is established when every community takes responsibility for creating healthy environments where our children can thrive. And whereas Thurston County supports the strengthening families' protective factors that reduce abuse and neglect through promoting social connections, knowledge of parenting and child development, parental resilience, concrete supports in times of need, and the social and emotional competence of children. And whereas a child's early experiences of being nurtured and bonded with consistent, caring adults affects all aspects of behavior and development, and is associated with better academic grades, healthier choices, improved physical and mental health, positive peer interactions, and an increased ability to cope with stress. And whereas the number of child abuse victims reported for Thurston County increased by 42% during the 2015-2019 time period. And in 2019, Thurston County's child abuse rate of 41.6 victims for 1,000 children was higher than the Washington state rate of 37.9 victims per 1,000 children. And whereas 19% of Thurston County adults experienced physical child abuse before turning age 18, and 39% of county adults experienced psychological abuse during their childhood. And whereas, while there are factors that build resilience in children, we also understand abuse experienced by a child results in trauma, which leaves a lasting impact. And whereas Thurston County recognizes it is the responsibility of every adult to protect children from all forms of adverse childhood experiences, including abuse and neglect, and recognizes the need for adults, organizations, schools, and communities to form protective barriers around children. And whereas effective child abuse prevention programs are essential and succeed because of community partnerships created among citizens, social service agencies, schools, businesses, law enforcement agencies, faith-based organizations, civic organizations, and other child-serving agencies. And whereas April 9th, 2021 is Go Blue Day, a day where when everyone is encouraged to wear blue to build awareness about child abuse and neglect prevention, and to inspire change by focusing on community activities and public policies that prioritizes prevention. Now, therefore, be it resolved, the Board of Health hereby proclaims April as Child Abuse Prevention Month in Thurston County, and urges all residents to actively participate in the care, well-being, and protection of our children. Adopted this 13th day of April 2021.
Thank you, Commissioner. Thank you, Shelley, for being here.
I don't know if I'm supposed to speak, but I'm going to try real quickly. I know you have a quick agenda. I just want to really thank Gretchen and Nurse Family Partnership and Shelley Slaughter at the Health Department. It is truly their ability to take action that help us provide this for the community, and we couldn't do it alone. So thank you very much.
Chair, I'd just like to point out that all of your commissioners are wearing blue today.
Shelley's got a nice blue as well, so thank you, Shelley Slaughter. All right, very good. Thank you. So now I think we can move to the opportunity for the public to address the Board of Health. The Thurston County Board of Health welcomes comments from the public at our meetings. However, there are guidelines governing such comments. Introduce yourself and the area of the county in which you reside. Address the board, not audience or staff. You'll have 4 minutes, which may not be donated to any other speaker. The board will not respond to public comment directly, but will county manager or director of public health will respond through follow-up with specific items on an as-needed basis. The board reserves the right to restrict an opportunity to address the meeting for good cause. No offensive, inflammatory, discriminatory, hateful comments. Please be respectful. No outbursts. Comments commercial in nature, or comments on pending land use permits or similar matters that might come before the board, the county commissioners, or the Board of Health on appeal. And any materials submitted to the board may be considered public records, subject to public release upon request pursuant to the Public Records Act, Chapter 4256 RCW. The sign-up sheet I've been handed has one name, and we'll start with John Pettit, and then we'll call for any other additional comments. Go ahead, sir.
Good afternoon, Commissioners. It seems like it's been forever since I saw you. Okay, well, maybe not forever. I want to tell you, first of all, my first comment is what a wonderful proclamation you made today. And it is something that we all need to be highly aware of and careful about. I didn't even really think too much about coming here to the Board of Health today, but then I got reminded of something because you have something about your sanitary code. And one of my many projects that I have going, in which I've had very good help from Art Starry and Steve Peterson and everyone over there. I recently got a system finally approved that'd been sitting for a long time, but it requires a continued update for the annual inspection. And my person that's hired to do it has been failing to show up to do it. And I've called like 6 more people to try to get somebody. And it is very difficult to get inspectors out to inspect a site, particularly ones that have a very unique drain field system for potential commercial facilities. So why I obviously think we need to have extensions, I would be inclined to say, and I'm sure that the people in the department would work with me, but I wouldn't want to go in violation of not getting the inspection done on a timely basis. So that's noted. The next thing which I want to talk about is I mentioned to you about my wonderful trip I made down to San Luis Obispo. And my son's going to be going to college there. And it was incredible to see a city the size of what is Lacey, basically same size. I did see two shopping carts that apparently had people that was for their homes, okay, out of 47,000 people, okay. I enjoyed knowing that the campus down there has a no smoking, no drugs, no, of any nature acceptable on the site. Not even vaping on the campus. So that was a really good thing. But it brings me to the topic which I just wanted to cover here briefly. We have a lot of very ill people in our community. We see an awful lot of them. They're located, in various spots. And, we recognize when we have people that are ill, we have to be attentive to their needs. They don't even necessarily recognize themselves as being out of control of their own well-being. We as a state recognize that if someone is drinking and driving, we basically suggest, let's go on down to the pokey and have someone else pick you up or something, or you're going to spend the night here, but we're not just going to let you keep doing it. Okay, in other words, we're going to have a provision to put you in a better, safer place, and the rest of society from what happens when people are in that condition. I think as the Board of Health, perhaps it may take a little work, but perhaps you can find a way to create some type of ordinance that when people are found to be intoxicated under the influence of drugs or such, that they can be like a person that's DUI. Maybe we can take them into a position until we resolve how we're going to help them. We don't want sick people laying around and not helping them. In our society, we're so careful about not wanting to violate people's rights that we forget about taking care of the people that can't make good decisions or haven't made good decisions about where they are. So I'd encourage you to look into something of that nature. Thank you.
I have no one else on the sign-up sheet. I don't know if there's anyone else in the boardroom. If not, I'd ask the
All right,
county
I don't see any, that we don't have anybody else in the room nor Zoom. Let me check the conference call just to make sure. Good afternoon. For those members of the public who have joined us via conference call this afternoon, if you'd like to provide public testimony before the Board of Health, please unmute yourself, state your name, where you reside in the county. You have 4 minutes. None, sir.
Okay, thank you. That concludes public comment. We'll go to item 4. This relates to an emergency ordinance, a proposal to extend pool permit expiration dates. Shelley, if you want to introduce this, we'll.
Yes, thank you so much, sir. We are asking the board to consider approving an emergency ordinance extending the expiration of existing water establishment permits in the Thurston County Sanitary Code. Currently, permits are set to expire on March 31st, which is now passed, and we are asking for a 4-month extension for for recreation establishments that have been impacted by COVID-19. And Mr. Sammy Berg, who is our Senior Environmental Health Specialist, is here to share more about this proposal. Sammy?
Thank you, Director Slaughter and board and Dr. Abdul-Malik. Yeah, we brought this emergency ordinance for your consideration concerning the water recreational facilities permits under Article 7 of the Sanitary Code. We're asking for, as Director Slaughter said, for an extension of those permits, primarily to allow those pools, spas, to basically have some time to evaluate if they're going to be able to functionally operate under the current COVID guidelines that are out now. Primarily, the main challenge that they face is that of the 106 pools that we permit in Thurston County, 87 of them are called limited use, which are basically like hotel pools or pools for apartment complexes where it's not necessarily a public pool, but it's there for the use of the residents or those staying there. And those pools operate under provisions which allow them to not have lifeguards and other staff there while the pool's open. And following the current state guidelines for being able to operate under COVID requires that they actively control the number of people that are in their facility and what those people do as far as masking and providing spacing and whatnot. And a number of the pools are trying to figure out if they are going to be able to do that in a way, either by bringing on staff or some other creative fashion to be able to operate those pools under those guidelines. And we're basically trying to essentially give them some time to try to figure that out before we require them to pay to renew their permits. So our idea is to move this to the end of July, where they'll be have that time to figure that out and basically commit to operating by that point and purchase their permits, or communicate with us and let us know that they're not going to be able to do that. And essentially, we're going to put their pool or spa on hold so they may essentially not get charged for this year and be able then to operate normally for the following year. And that's essentially the content of this emergency ordinance request is making those changes to Article 7 that basically would allow us to extend those permits until the end of July of this year to give them that time to make that determination.
Question for Sammy, Commissioner Edwards.
Yes, sir. Out of those 106 facilities, 3 of them chose to seek reimbursements. Did they get that reimbursement?
Yes, and actually we're talking to a couple of them now and those reimbursements for 2020, when a lot of them were actually closed by guidance from the state, and yeah, so they did receive those reimbursements, or we basically canceled the fees for last year for those facilities that chose to do that, and basically we're looking to. Instead of having to have them pay and then seek reimbursement because they weren't able to operate, we're trying to allow them the time to make that determination now, so we can then just cancel fees and not have to that give and take of them sending us money and us sending them back if they make that decision for this year. So we're trying to learn and give them a little more flexibility for this year and give them again that time to make that determination.
Has there been any discussion about possibly canceling the fees? It sounds like about 100 of these folks paid for a permit they were not able to use. And I would like to see if we couldn't pay their upcoming fee out of the CARES Act dollars so that they're not going to get dinged at all because it sounds like they got beat out of some money through no fault of their own. And I would think that that would fall under that CARES Act. So any shortage you would receive in your agency to oversee that stuff, granted, I suppose you need revenue to do that. I would think we'd be able to backfill that with that CARES and the COVID-19 money that we're getting as pass-through money.
So
I
if
just
I may,
hate to see the citizens pay for something they're not going to get. And if we can't do that, I would like to see this extended at least until the end of August to give them a little more leeway. We're going to be into July in about 3 months. So that's going to come along pretty fast. So
Okay.
I'm just wondering about, did you discuss any of that? Any of those potentials?
Sure. And you're right. The permits provide revenue of about $130,000 that covers our inspectors to go out and make sure that the pools are being operated safely, that the chemicals are at the right level, there's enough sanitizer and all that, and that all works. A number of I had some conversation with our department's COVID fiscal lead and asking those questions. And one of the complications that was raised was that if we're choosing to not collect these fees off businesses that are still, that have been clearly been impacted, but not closed. It's not like it's not like, say, we were trying to that the county lost X number of dollars of permit fees because half the restaurants closed, for instance, as an example, where we actually had that loss, versus in this case, we're choosing not to collect fees from businesses that still exist. Would the CARES Act actually reimburse those fees? At least our preliminary discussion around those was that they would not meet that criteria, but that we can look to try to get a more definitive answer. The other side of that question, though, or point would be that there's some equity questions around the other folks that have been impacted, other businesses that have been impacted by similar conditions, like, say, our food establishments and whatnot, that we are also, as basically a $1 million program, don't have the funds to just forgive those fees as well. And as opposed to, these are either hotels or apartment complexes that could operate without their pools. They're an amenity. They're and something that the residents enjoy, but they are basically an amenity for their operation, versus a business that cannot operate at all without a permit. And so the equity of us looking to not charge, say, the pool permit holders for their things, while we are also still out there looking at restaurants and charging them fees for that service that we provide to protect the public health from that perspective. So there's kind of two answers, essentially, that it's likely that those fees would not be reimbursable for those pool permits that we choose not to collect, and then as well the kind of equity of how we're choosing to help them out, and possibly not be able to help others out as well.
We're in the business right now, spreading millions of dollars to businesses that are struggling. I contend that these businesses are struggling, and we're given $10,000 grants, for an example, to a restaurant that's struggling. So I don't see any difference here. I really do think that small businesses that make up the majority of our economic engine in this community need any bit of help they can get. And it bothers me that they had to buy a permit for 2020 and we're not able to use it. And now we're talking about doing it again. And they're going to decide whether or not they need to buy the permit. And we don't know what's coming and neither do they. So I would like to see these folks become eligible for COVID-19 money. It's my understanding that it's flexible enough that it will cover almost anything. And if we have not specifically looked at this and discussed it with legal counsel, I would like to do that. In the meantime, we could extend this for, I'd opt to do it for a longer period of time, but I would like to see the citizens get a benefit out of this CARES money in every area where we possibly could, and legally do so. Thank you.
Commissioner Mejia.
I mean, would there be, I mean, if it were extended beside, you know, after the July 31st, 2021 proposed date, is there pros and cons with why that date was chosen? Can it be extended throughout the rest of the year?
So we chose that date for one reason, basically to give them some time to make that determination, but also that it would still be during the summer period where most of those pools are being put to use, so that that we can, you know, by that time they would have determined how they could operate and if they wanted to, and then pay for those permits, or choose to basically take a pass on the year and have their those fees canceled and then be able to operate in 2022. We're looking to not extend that past you know, more into the fall, as most of those permit holders then would have been through the summer in the period of the permit use, and they're basically just, we're hoping to use that time frame as an opportunity to get them to make that commitment about to operate or not to operate and talk to us about it, versus not hear from them and basically have that continue on into the fall and kind of miss that window. Functionally, there's not a particular reason to, I guess that was the main reason we chose that date, was to still have that date come due during that summer season. So it made sense that if you still wanted to use this permit for this time period, then here's the fees that would go along with that.
Just a follow-up question to that, Sammy. I mean, these are commercial pools, is that correct? So it's like the YMCA, it's like aquatics places that teach classes. Most of these places are indoors, so they're still functioning during the fall, are they not?
So there are a number of pools that are seasonal, and those will be primarily outdoor pools. So that's about 60 of our pools. So overall, we have just over 100 pool facilities. About 60 of them are seasonal only. So they operate from Memorial Day to Labor Day. So they're just a summer purpose. The remainder are, yes, like you said, the indoor pools, or that they have an outdoor pool and an indoor spa. So they have so 40 of them have that year-round operation, and about 60 of them are summer use only. But the bulk of them are those limited use pools where they're the hotel or apartment complex style, versus the more public ones like you mentioned, the YMCA, the Valley Athletic, a couple of the high schools operate public pools, the downtown public Olympia Fountain. Those are a smaller number of the pool facilities in Thurston County.
Chair, could I make a comment, sir?
Sure.
What would it matter? We had 100 and some of these outfits buy a permit in 2020, didn't get to use it. Why couldn't we just extend this to the end of the year? That way they can still use that permit if they need to. And if the county ends up being short on some of their inspection process because they don't have quite the revenue, I think we can backfill that out of that COVID-19 money. And that way we're spreading this around to all of the entities around the community that get a fair shot in equity at this whole thing. I'm done. Yes, sir. I see the county manager has his hand up.
Sorry, I have to attend another meeting here in 5 minutes. So a couple of thoughts related to the federal relief money that is coming. The board has not made any decisions yet, and we're still waiting the guidelines from this Department's Treasury to see what activities can be allocated. But you highlighted a good opportunity, Commissioner Edwards, through the Thurston Strong. If the board decides to go that direction, any business who perceive they have been faulted by or the revenues have been reduced by the impacts of COVID-19, they have access to that. And that is an equitable way as to all the businesses to access those grants, as you stated. And the last point I want to make is a point of order. If there is a particular suggestion to change the date or the proposal, my suggestions at this point is to introduce the motion, and then whatever commissioner would like to introduce an amendment, and then you will vote on that amendment. And however that goes, then move forward. That will be my suggestion. But sorry, I have to leave.
Okay, thank you. Well, I guess taking that into consideration, I would move to extend this.
No, Commissioner, you introduce the motion. During the discussion, you introduce an amendment to the motion.
Okay, well, I'll make an amendment to the motion then.
You need
I'm in the middle of discussion, no?
No, the vice chair has not introduced the motion yet.
Okay. Okay, I'm ready.
Before that time, I have some questions. So the 106 pools, that's the total number of pools, including these limited use and non-limited use?
Yeah, so we have 106 different facilities. Some of them have more than one actual pool or spa. So there's 106 properties. So like the Valley Athletic Club has 7 actual pools and spa units kind of combined. So it's 106 facilities. The bulk of those are those hotel and or apartment complexes.
What is the current guidance? You're saying that right now, phase 3 roadmap to recovery or whatnot, that a pool can operate under certain, like, if they have staffing to make sure that people are a certain distance or something, or a certain number of people per
Right.
square
So
foot? What?
Oh, sorry. So, but yeah, there's basically an equation that helps them figure out based on essentially surface area, how much of decking, a space around the pool, how big the pool is, and that they can calculate basically how many people can use that and still provide safe spacing between those users and each other. Sometimes it fluctuates depending on whether or not you're having, say, an aquatic class where you have some fairly controlled movement, or you have just a bunch of kids playing in the pool. So they can do those calculations and figure out, for instance, that just to make something up, that 20 people can be in the pool at the same time. So then how do you control that? If, say, for instance, at the apartment complex, that everyone has a key card to get into it, is a sign sufficient to say, hey, only 20 people at a time, and we need to make appointments to use one person at a time in the spa. They could maybe choose to do that, but they also have to try to figure out how to basically take prudent action to make sure that people are coming with their mask and wearing their masks on the deck versus in the pool, following those guidelines that they post. It's depending on which facility you talk to, they come to different decisions about whether or not they can just put a sign up, or whether or not they actually need to have, say, not necessarily a lifeguard, but a staff person that is able to monitor what's going on in that space and make sure it doesn't get too crowded for those operations. And for those are the ones we're trying to give them that time to try to figure that out. And some of them will likely try to operate and see what works for them. And we're trying to give them that time to just practically and functionally put those things into place and see if those, if they're working for them. And as opposed to, if we hadn't taken this measure or proposed this, then by now they would have already had to financially commit to doing something.
And I assume that the virus doesn't survive it's about people's proximity. It's not, the virus doesn't live in chlorinated water.
Correct. Yeah. So from the beginning, the pool itself has not been a problem for COVID spread. It's been the people around the pool, essentially, that just like people around in any other location, it's that person to person breathing and communication.
Okay. At this point, unless there's further questions, I would entertain a motion if there is one.
Oh, that's right, it's me. Sorry, I was looking at Commissioner Edwards. I would move to approve an emergency ordinance extending the expiration of existing water recreation establishment permits to July 31, 2021, and waiving water recreation facility permit late fees as a result of the emergency due to COVID-19 outbreak.
And I will second that for discussion.
Okay, it's been moved and seconded, and now we're in discussion of this motion, and we can discuss, or there could be an amendment, I suppose, at this point.
I would make an amendment to change that expiration date to the end of the year in 2021. So
December 31.
December 31st, 2021.
There's a motion to amend the underlying motion to change expiration date. Is there a second to that?
Second.
It's been moved and seconded. Is there discussion on the amendment, proposed amendment?
Oh, sir.
I guess I would just say that I don't know what the guidance is going to be for sure. And I agree with the county manager that the businesses have access to money through Thurston Strong. And I think that this date is well thought out based on that middle ground between folks, all those seasonal permits that may be able to be used. So I support the underlying motion unamended. But at this point, if there's no further discussion, I'll call for a vote on the amendment. All in favor of the amendment, say aye.
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 Opposed, nay. I'm a nay. So the amendment passes by majority. And so now we can discuss the motion as amended. If there is any further discussion on the amended motion.
Yes, I have some.
Go ahead.
My feeling is that we should be doing what we can for our citizens anytime we can. And it looks to me like these folks bought a license in 2020 and were never able to use it. And I would hope this will help them succeed in their endeavors, whatever they might be, because I know times are tough for those folks out there that are struggling to get things done. So I just think it's an opportunity for the county to participate in helping. And that's it. Thank you, sir.
I agree with that. I think if a permit wasn't able to be, no one was foreseeing what happened last year. And even this year, it's still kind of unforeseeable. And any way that we can be flexible, I feel it's always a good step forward. And, even though those resources are available with Thurston Strong, I mean, it won't put them in, most of these places where they were before. And so anything that we can do to support, I'm all for it. And, I feel like it also gives staff some time to follow up. And I appreciate staff just bringing this forward and just trying to work with people. I really do. But I also, my concerns also comes to those people who have indoor pools and, want to keep the permit active throughout the fall and winter months or until the end of the year.
I guess I would just say that, as I understood it, the permits equal $130,000 in revenue to the county, and I do not feel like we have well thought out how we're going to manage that shortfall based on this policy decision. So I'm going to oppose, but at this point, I'll call for the vote. All in favor, say aye.
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 Opposed, nay, nay. The motion passes 2-1.
Okay, and thank you for your time.
Thank you.
Thank you.
That takes us to Board of Health members, health-related activities and accomplishments. I'll start with Commissioner Edwards.
And I'll keep mine real short. Everything that I've been doing in the line of public health has been COVID. COVID, where can we get shots? When's it going to be over? My phone never quits ringing about COVID. And that's kind of where I'm at. Thank you.
Commissioner Mejia.
I think that's where everyone's at. I'm pretty sure Shelley and Dr. A is, that's all they hear. But also just, just trying to give out as much information as possible in regards to our vaccine efforts and what we're doing. I got to speak this weekend at an event, and we, just relayed out the efforts that we're doing here in Thurston in regards to just getting vaccines out in an equitable way, and was really proud to just put out the information about all the loops we've had to jump through and how flexible we've been through this whole process. I'm also going to be volunteering at some of the clinics coming up. One of them is on the 24th for the Spanish clinic. Thank you, Shelley, for putting that on. And I'm excited to help any way I can.
Okay. I, like my seatmates, have had multiple opportunities to report to the community, different community groups about what's the status of our vaccination efforts are. And as I mentioned at the board meeting, toward the fairgrounds vaccination site. Another thing I wanted to bring up was a communication that I believe all the board members got about the potential expanding a suicide prevention training. There's some trainings going on, and there was a suggestion that the county might have, or a query if the county would have resources to expand the number of trainings because it's been very successful. And I guess if my seatmates don't are willing or don't object, I maybe would ask Shelley to kind of follow up on that at a later point to kind of, so we could sort of see what, if there is a funding stream that would apply to such a situation that the board could consider. And I'd hope my seatmates would allow her to do that and then maybe report back to us at a later point. Is that
Chair?
reasonable? Yes.
I guess I'd like to follow up. You guys are going to think I'm after that COVID-19 fund, but our young people have really been stressed out with this whole virus thing, and staying at home, not being able to interact in school and such. I think right there is a good source, again, to go after that COVID-19 money to help these young people survive this dark spot in their life.
We'll put that at the top of our list then.
Okay.
Possibilities.
Okay.
Okay. Thank you. Is that okay, Commissioner Mejia?
Yes.
Very good. Let's go to item 6, which is our health officer's report, and we have Dr. A waiting patiently.
Good afternoon, commissioners. I just wanted to share a few bits of information with all of you. I'm going to start with COVID, which has been at the top of our minds recently, along with all of the different effects that it's had on our community. So first things first, our case rates are higher than they were 2 weeks ago. We are currently at 119.2 cases per 100,000, and we're seeing an increase in test positivity, so 4%. in our county, and we're watching very carefully as we know that a lot of folks traveled for spring break, and we'll continue to watch and see what impact that has on disease activity in our county. And we continue to encourage everyone to mask in public regardless of vaccination status, maintain 6 feet or more of distance between themselves and non-household members when out in public, get tested and stay home when they're sick, regardless of where they are in terms of their vaccination process. Which brings me to my second update, which is on vaccine. I'm going to start with the cautionary news first, and then go into the more brighter news that we have to share with all of you today. So this morning, the CDC, as well as the Washington State Department of Health, issued an alert about the Johnson & Johnson vaccine based on 6 cases of women aged 18 to 48 who developed a cerebral venous thrombosis. This is currently, this is out of more than 6.8 million doses of the vaccine that have been given in the US thus far. So this is definitely a very, very rare event. In the CDC and as well as ACIP, so the advisory community, the advisory committee on immunization practices will be reviewing all of that data tomorrow, actually, in an emergency meeting, and we'll be able to share that guidance out with the public once that takes place. In response to this, we, along with all COVID-19 vaccine providers in the state of Washington, have paused use of Johnson & Johnson vaccine until that piece gets worked out, and we have final guidance on that. While we're waiting on that, it's actually showing us how well our vaccine adverse reaction reporting system is. This was picked up based on VAERS, which is how the CDC tracks vaccine reactions. So anytime there's a reaction, around a vaccination site or anything that could even be possibly linked to a vaccine, we all report it to the CDC, and that includes us and all vaccine providers. And patients themselves can also submit reports, and the CDC sorts through and looks for trends, and that's often how this is picked up. If folks are experiencing symptoms that are concerning, including headaches, leg pain, abdominal pain, increased bruising or increased bleeding than normal, they're encouraged to see their healthcare provider. And healthcare providers, if they make a determination, are encouraged to report those into the VAERS system so that the CDC is aware of those events. We do not expect, we are heartened that this is, that this just represents a small group of people, fewer than 1 in a million, but more study is definitely needed, and we're watching the situation very carefully. This brings me to our much better news, which is that vaccination overall in Thurston County has been going exceedingly well. At our South Puget Sound Community College site, which is our large community vaccination site, we gave our 20,000th dose of COVID-19 vaccine yesterday morning. So that represents a lot of work, both from our team, as well as many, many folks in our county, as well as legions of volunteers from United Way. So that has been a stunning success. I did have a few more updates in terms of our current Thurston County data with regard to vaccine. So to date, 153,623 doses of COVID-19 vaccine have been administered to Thurston County residents. And 33.5% of Thurston County residents have received at least one dose of COVID-19 vaccine. And roughly 22% of Thurston County residents have been fully vaccinated, which is encouraging and is in alignment with the state's numbers as well. So we are definitely in line with the rest of of Washington State. The biggest piece of news, and something that we have been extremely excited for a long time, is that starting April 15th, 2021, all Washingtonians aged 16 and up who don't have contraindications, meaning that they're not allergic to the vaccine, and there are a few more minor ones, but that's the big contraindication, will be eligible for COVID-19 vaccine. So the Moderna and Johnson & Johnson vaccines are approved for folks aged 18 and up, and Pfizer is the only vaccine that's approved for ages 16 and up. I am watching anxiously for the FDA to review Pfizer's data for the 12 to 15 year age range, but that has not yet been approved. We also have been getting asked where folks can get the COVID-19 vaccine. So a number of healthcare providers, including physicians' offices, dialysis centers, and other places are able to provide COVID-19 vaccine, as well as pharmacies. And this is in addition, of course, to our efforts here at Thurston County Public Health and Social Services. In terms of finding vaccine, we have been using the Washington State Department of Health vaccine locator to find vaccine. So folks can put in their zip code and then find facilities within range that have available appointments, and they can even see what type of vaccine is being dispensed. Although my solid advice is that the best vaccine is the vaccine that is found to be safe and effective by the CDC and the FDA and is the first available to you. You can also find Thurston County Public Health and Social Services clinics on our website. In terms of where we're going in our vaccination efforts, in addition to providing access to all Thurston County residents through large-scale community vaccination, we're also working on outreach to folks experiencing linguistic barriers, and are partnering with Cielo, folks experiencing transportation barriers, and we're collaborating with BoH and looking at folks who may be homebound or may have other barriers to getting to vaccination sites, as well as other access barriers. So we're coordinating with our houseless population to work on vaccination as well. This is just a small. This is a snapshot of what we're doing, and we're continuing as we see the needs in our community. We are moving our efforts to address them. In terms of our next steps, as far as vaccine goes, we are continuing to focus on access to vaccine. So making sure that we are able to dispense all of and help facilitate our partners throughout the county in dispensing all of the vaccine that's allocated to us as a county. And this includes continuing our large-scale community vaccination site, our outreach efforts, and then all of our efforts in supporting our partners who are also dispensing vaccine. This is a time of transition. We are both seeing an increase in cases as well as an increase in vaccination, which gives us hope. And we are looking forward to working with all of you and all of the residents in our county in terms of getting vaccinated and hopefully bringing about a return to a normal public life, or at least a new and better normal. Thanks.
Commissioner Edwards, questions for Dr. Abdulmalik?
Just two real quick ones here. Do the numbers that you provided, the percentages and such, do they include all of those pharmacies and clinics and such that are going on around the community that are not affiliated with the county? So they are all inclusive?
So the percentages that I gave are actually they're of doses administered to Thurston County residents, regardless of where or how they receive those doses or which county they receive those doses in.
And then what about adverse reactions to regular flu shots? We're getting 1 out of 1 million with the COVID-19, vaccination. What do we normally get just out of the flu when we're giving vaccinations to citizens about, say, out of 1 million? I would think we get probably even more than that, don't we?
So we do get adverse reactions from the flu shot. I'll definitely have to look at the specific numbers. This particular type of reaction that was described is people are exploring the link to the type of vaccine used. So thinking that it may. So they're looking both at Johnson & Johnson as well as the AstraZeneca vaccine, which uses a similar process to introduce the spike protein information into cells. So while there are side effects to all medications and all vaccines, I'm definitely going to look at the flu shot. This particular side effect is one that we're looking at with particular vaccines that are made in a specific way for COVID-19.
Okay, thank you.
Dr. A, I have a question that this is kind of speculative, but I just want to get your sense of whether or not the public's will is strong enough to, are we going to get enough people vaccinated to make the difference that we need? Or is there going to be a resistance factor that's too great to reach that, whether it's 70%, 80%, whatever that number is, do we have enough percentage of the public willing to get vaccinated? What's your sense of that?
So far, our public has been really enthusiastic. I'm not going to lie, I hear cheering multiple times a day. So I'm on site at our vaccination clinics. I know that there are people who are considering vaccine and are still, on the fence, weighing the data, weighing their options. And my hope is that as we go forward and as folks see the benefits of getting vaccinated, more and more folks will join and become vaccinated as well. So we're at a little bit of an inflection point. We're expecting so far there's been a lot of enthusiasm, and then once we are also working on figuring out how to support people who still have questions and concerns in determining what vaccine is right for them and what strategy is right for them. So it is so we're a little bit we're early on in our process.
I got worried when last night I was watching a Saturday Night Live skit. I think it's like a week old, but it was a skit about people that were not going to get vaccinated, and no matter what you offered them. And obviously that's just comedy, but it got me thinking about what that number might be in terms of folks that just have some sort of sense that it's not safe, and how we can overcome that. So thank you. Let's go to our director's report with Shelley Slaughter.
Thank you so much, Mr. Chair, and thank you to everyone who presented today. And I want to take this opportunity to give a really special thanks to all of our public health employees. Last week, people around the country celebrated the American Public Health Association's National Public Health Week, which is the first week of April every year. And we didn't have the chance to recognize that at one of our normal BOCC or Board of Health meetings. And so I wanted to take a moment and read a portion of a proclamation that came from the White House last week, because I think it really speaks to the great work that our public health workers have done over this last year and every single day in their jobs. So this is from President Biden. National Public Health Week has increased significance this year. As our nation mourns the loss of more than 500,000 lives to COVID-19, and as we have come to recognize just how essential our public health efforts and public health workers truly are. Whether it is the scientists and researchers who developed life-saving vaccines in record time, or local leaders who have taken evidence-based actions to keep their communities safe, or the staff and volunteers who have worked to slow the spread of the virus through testing, case investigation, and contact tracing, or the doctors, nurses, and clinicians who continue to provide around-the-clock care to those who have fallen ill. Dedicated public health professionals on the front lines of our response to COVID-19 deserve our gratitude. During National Public Health Week, we ask everyone to come together to help restore the health of our nation. Every American can do their patriotic duty for their neighbors, their loved ones, and our country by continuing to wear masks, as recommended by the Center for Disease Control and Prevention, practicing physical distancing, getting the COVID-19 when it is their turn, and by expressing gratitude to public health professionals who are seeing us through this crisis and who are building a more robust, comprehensive, and equitable public health system for us all. I know that our employees and our volunteers have been working so hard, and we get, as Dr. A said, we get to hear those cheers in the vaccine lines as people come through our drive-through clinic, and we get to hear the words of encouragement and thanks and gratitude and receive the emails. And I just want everyone to know that we read those, we appreciate that. It motivates us and keeps us going. And to all of our staff at Thurston County Public Health and Social Services, I want to say thank you to everything that you do every single day. And with that, wanted to have the chance, we talk a lot about our COVID-19 work and our vaccine work, but we have many of our employees who work in our foundational public health programs, such as environmental health, community prevention, communicable disease prevention, vital services, maternal child health, as well as all of our social and human service programs. And they keep our community safe, healthy, and thriving every day. And so I want to share a few of those highlights and what we've been working on over this last month and what we have coming up. In our education and prevention program, our staff have continued to support youth substance use prevention work through our CPWI coalitions and have begun adding new programs in Tumwater and soon more in Tenino, and we're very excited about that. We held 2 workshops of our new Healthy Home and Garden series, the natural lawn care and indoor air quality, and we had a lot of great enthusiasm about that, with 40 registered, 33 participated, and 10 who completed our Healthy Homes Pledge. We've continued our efforts across our 7-county Cascade Pacific Action Alliance region to deliver policy and environmental changes that prevent the use of tobacco and vaping, particularly with youth. We had our first chronic pain self-management workshop this month, and that filled within 1 week of opening. So this will run through late May, and with this kind of response, we hope to be able to continue to offer that more in the future. We held 2 additional workshops of our Healthy Home and Garden series, one about safer cleaning practices at home and another about dealing with mold, with 37 attending and more expressing interest in that, and that's held virtually online. And we also presented to a local nonprofit organization in preparation for distributing green cleaning kits to residents in their permanent supportive housing program. and to 17 residents in Thurston County via Zoom about how to reduce, store, and properly dispose of hazardous materials in collaboration with Thurston County Solid Waste. Our environmental health staff also support our COVID-19 response by providing technical assistance to businesses who are trying to navigate and learn the constantly changing COVID-19 requirements and guidelines released by the governor and Washington State Department of Health in association with phase 3, which we remain in at this time. We will continue to monitor our cases and our new hospitalization rates, but we are happy that we are currently still in phase 3. These new guidelines, we encourage people to frequently check the governor's office website, as well as our Thurston County Public Health website to see what guidance has changed, everything from museums to agritourism to spectator events and school safety. We also have a phone number that businesses can call if they're seeking help, as well as an email. That number is 360-867-2634. And that email is COVID-19 Thurston PHSS at co.thurston.wa.us. And you don't have to memorize that. You can find that on our website. And Art Starry and Sammy Berg, who are with us today, help to run that program. They've also been instrumental in helping to get our kids back to school. Our team inspected local school districts, helped to support them in having kids safely come back to the classroom. This included elementary school visits, as well as discussions with district staff. And the district staff, we want to really commend them for what a great job that they have done in following the COVID-19 guidance. Also in environmental health, we continue to see these early algae blooms that we've discussed at the last couple Board of Health meetings. Algae blooms have been spotted over the last month in Pattison Lake, Black Lake, Hewitt Lake, and Ward Lake. And our staff have been will be participating this month with Washington State Department of Health to discuss the algae response protocol. And at our next Board of Health meeting, we'll be featuring our lake program and discussing toxic algae in lakes in more detail. In our Office of Housing and Homeless Prevention, we are really pleased that 2021 Rental Assistance Program opened last week on April 7th, and we have contracted with Community Action Council to schedule appointments for rent and utility assistance to people who've been impacted by COVID-19. And if people are interested, they can apply online at www.caclmt.org. That stands for Community Action Council of Lewis, Mason, and Thurston counties. Or they can call 360-438-1100. And there is more information about who is eligible for that program on our website, as well as with the Community Action Council. Our syringe services program has also been in extremely high demand. Over the last year, staff have served 2,544 people. This is the highest in 4 years that we have seen. And we encourage anyone who is struggling and needs help with syringe services, testing, or opioid support, such as Narcan. They may call 360-490-9155 for more details and to schedule an appointment. And again, I want to extend my deep gratitude to all the volunteers in our community who are helping to vaccinate Thurston County. We're so proud of our efforts thus far. We still have a long ways to go. We really need help. We encourage people who are interested in volunteering to visit unitedway-thurston.org to sign up to volunteer at our upcoming mass vaccination efforts and other vaccine clinics that we plan to hold and increase as more people in the public become eligible to get vaccines starting tomorrow. So we're very excited about that. Please volunteer and thank you. And then for those that are still needing special assistance that may have challenges in accessing the internet or any of these other websites or information that I've shared today, we're happy to help at Public Health. We have amazing and kind staff that are answering the phones every day, and you may reach them at 360-867-2610. Thank you very much, and I'm happy to answer any questions that the board has.
Commissioner Edwards?
No, sir, I don't have any questions. And you notice I don't have my mask on. I'm here in the room by myself. See?
You don't even have the county manager. We'll let you high and dry in there. All right. Commissioner Mejia is moved to Zoom, so calling you next.
No, I don't have any questions. Well, maybe just one. With the vaccination process opening up to basically everyone tomorrow, have you guys measured the impact of, how many people are going to be trying to get in? Do we have an idea on that? Are we ready for it? Or are we going to go back to the days where, appointment slots were filling up in 10 minutes?
We don't know yet, but we do expect that demand is going to exceed our vaccine supply, at least for the next few weeks. We have many more people eligible than we have vaccine for. So we ask people to be patient and please continue to look at Vaccine Locator to find places in Thurston County where you can get vaccines, as well as our Thurston County Public Health website. But we have been planning for this. We have an amazing team, over 100 people every day at our mass vac sites. We have prepared to have the ability to expand to have 2 mass vac sites operating concurrently at Thurston County Fairgrounds, as well as South Puget Sound Community College when we have enough vaccine supply, and assuming that that demand is there, and we sure hope that it will be, because we want everyone to be vaccinated. And in addition, as Dr. A mentioned in her report earlier, we're also offering mobile clinics and special clinics to populations throughout Thurston County who may not be able to access one of our mass vaccination sites. So we have lots of plans in place. We have worked hard to prepare for this, and we have all the infrastructure in place to efficiently and quickly deliver vaccine. But we do need more help, and that's why I wanted to give a shout out to our United Way, because we can't do this without our whole entire community's help.
Thank you.
Okay. So thank you for the shout out to the public health workers. I second everything you said, Shelley. Very important to recognize their work over this last year. I've been trying to follow the guidance, set a good example, and follow the rules. And I just have not. I mean, I'll just be honest. Like, my life is busy, and I don't have time to sit there and monitor the website. And I just learned, when the phase 3 thing came out, they had held off. They held off for at least a couple of weeks on social gathering, indoor and outdoor, and 2 household limits. And somehow it just got by me that had been changed. And I just learned this morning that the numbers are totally different now. Those household limits aren't there. The expansion of the businesses, live music venues, for example, which is something I'm interested in because I play music, but they were very strict last year on singing, like singers. You couldn't, like, even when they allowed like a solo performer with an instrument, you couldn't sing. And now, and I scoured the state websites today and all the articles I could find from Seattle newspapers, and all I could find was live entertainment is fine as long as you're within the guidelines of the venue that you're performing in. So, like, they just kind of scrapped all those really detailed rules, from what I could tell, unless I'm missing something. Asking you and Dr. A if you've heard anything about. So it sounds like it said you can gather indoors as long as it's no more than 10 people, and it doesn't matter if they're from 10 different households. That's a pretty radical change from that 2 household limit that was even applicable outdoors up until like 2 weeks ago. I never heard anything about it on the news or anywhere. And then this whole thing about singing and live entertainment, I'm just wondering if you can give me any more detail than what I've heard, because obviously I'm not looking in the right place.
I can certainly agree with you and share that yes, the guidance is changing quickly. It's very frequently updated. It can be challenging to find. The governor made some changes on Friday, and then Washington State Department of Health further released some details to those changes tomorrow. We're still digesting all of that. Our business team that I mentioned earlier in the report, they work hard to stay on top of that and look through that so that they can give guidance to people who have questions just like yours. So I would say we'll share more information to answer your specific questions, Commissioner Menzer, and I know others in the public as well. And I really encourage that the best place to look at that updated guidance is on Governor Inslee's website, the Roadmap to Recovery specific link that shares all the details of that guidance. And there is quite a lot of it. If you have any questions, give us a call.
Sounds like that's pretty brand new as of last Friday, so I'm not too far behind because I didn't see when it was changed. Somebody was asking me, there's a group that used to play music downtown in a rotating, and I was asked, like, you guys, who's willing to go do this? And I was like, what are you talking about? We can't do that, but apparently it is feasible or legal to do it. So I'll take a look, but yeah, okay. Well, that makes me feel better if I'm only a couple days late versus a couple of weeks. Okay, anything else for Shelley, Dr.?
Yeah, just one more quick kind of put her on the spot, her or the doctor, one of the two.
Yeah.
Why, can you give me a good explanation as to why, if somebody has had their shots, why do they have to continue wearing the mask? Can you, and if it's for show, I understand that, to keep from people being worried about them. Maybe they don't know. We don't have a V or something, vaccination brand on our forehead, but why is it that once you've had your 2 weeks behind your shots, everything's good, because the percentage chance of you coming down to the virus, hence passing the virus on, is almost zero. It's about like that 1 in a million that might be a blood clot. So can you give me a good answer without beating around the bush?
Yeah, so my first thing is that it's considerably more, the risk is considerably higher than 1 in a million. When you're looking at reduction in asymptomatic transmission, you're looking at a 2/3 reduction. So that's definitely not zero. It's considerably higher than zero.
Doctor, that might be the answer. I mean, if that's the case, I've never heard that before. So good.
Yeah, so there is some asymptomatic spread that we're still quantifying. There's lots of studies being done. It's really incredible that our vaccines all reduce that risk significantly, but it definitely isn't bringing it down to zero. There are more than 100 breakthrough cases in Washington State, but the good news is that they protect folks even if they do get COVID-19 and don't show symptoms. It protects them from the worst impacts of the disease. The other piece is not quite that it's for show, it's that it's exactly the problem that you pinpointed, which is that when you're walking around in public, we don't know who's fully vaccinated. And at this point in our county, it's a little over 20% have had both doses of a 2-dose vaccine or a single dose of Johnson & Johnson. So it gets a little bit complicated to figure all of those pieces out. I know the CDC is waiting to see what percentage of folks have to be vaccinated before the risk of transmission is so low that we can remove our masks in public.
Okay, man, just maybe one comment for you. I had a friend up at the airport at SeaTac on Friday evening, and he has never seen it busier. Never seen it busier in all of his long life. And the traffic was worse than it's ever been. So I don't know, you might kind of mark your calendar and take a look for 10 days down the road. But and I was quite surprised that the media did not cover that. oftentimes they'll say, well, things the TSA, so many people went through, but it's amazing to me, the numbers of people that are I think they've had it. So at some point, we're gonna have to come up with something where people are gonna quit following the rules, I'm afraid, if we don't be straight up with them. And your 2/3 answer, I mean, that makes sense to me. If that's the case, I don't know as it's quite 2/3, but if you could come up with something solid and justify what you're asking the public to do, I think you'll get more participation by justifying with the truth than you will speculating and, oh, it looks good or whatever they're suspecting, because a lot of suspicion out there right now. So thank you very much for all you folks do and the volunteers. Thank you.
Okay, with that, we are adjourned. Thank you, everybody.
Thank you.